Hi, I'd like to do a quick update about my surgery. I had my surgery on January 8th and it is now, let's see, the 25th. So yeah, it's been a minute, 2.5 weeks or so. Actually, I go to see the doctor tomorrow, my surgeon tomorrow. So I'm doing really well, I have to say. Every day I'm having less and less scalp pain. I will say it feels very tight back here. Yeah, my skin is really tight, I guess, from the stitches. I think it's healing really well. You can see the back of my head. I don't even know if you can see the scar or where the drain was. So it's healing, I think, very nicely. This was the first time I took a shower and it wasn't like killing me to have the water touch my hair, and like to comb it, I have to go like this. I comb it, I go like that because like I can't touch in here at all. I'm still having difficulty sleeping. So I have to keep the airplane pillow around my neck because it's bulky enough that I could put my head back and it just touches the pillow and not my head. I have been trouble sleeping in my bed, so I've been sleeping either on the couch or on the recliner, but it is improving. So I think it went really well. I did want to share with you that the doctor had said, and he told me he's going to show me the surgery. So I'm like, oh, okay, maybe I'll look at it tomorrow. I don't know if it's going to freak me out or not, but anyway, his name is Dr. Ahmed Nasser, by the way, and he's at the Surgery and Reconstruction Center it's in Shrewsbury, New Jersey, Red Bank, and Bricktown. Anyway, what he said was that the nerves were totally jacked. They were completely embedded in scar tissue. He said in a couple areas, if you looked at my other video where you saw him mark up my head, he said it was almost like knuckles of scar tissue, like really, really thick. So again, my surgery took over 6 hours, but he had to cut through fascia, cut through muscle, find the nerves, all the way from my neck up to the top. I mean, it's quite the surgery, but I will tell you, it's been, what, 2.5 weeks? Watch this, ready? This is a big deal. I can look all the way to the right and all the way to the left. I haven't been able to do that in over 2 years because when I would do that, the nerves were encased and couldn't move. So they would stretch and hurt so badly. So up is a little tough. Ooh, and down's not good. That's not good yet. But it will be. So right now, I'm taking it slow. I personally am having some trouble walking still. My brain injury doctor did prescribe me some meclizine to take to help me with my dizziness. The goal right now is, to heal, be careful. I still have weight restrictions. I can't pick anything heavy up. I'm not supposed to bend over. You don't want fluid gathering in your head. And oh, that's the other thing. It is so itchy. Like when you have almost like sunburn, like a really, really painful itch. Like it itches so bad, but like if you touch it, it hurts so bad. Like you just want to rip your skin off. That's what I feel like sometimes. So right now I'm feeling that in the back, like, whoa. But I can handle it. I did a little bit of driving. I did okay. I got very, very tired very quickly. So I am noticing my eyes are still getting very tired and there is pain in my eyes. The vestibular stuff, I still get a little wonky sometimes. I don't think that's an occipital thing. I think that's a vestibular migraine thing. So we'll see. My brain doctor said that she's really hoping that in April or May, as I start getting sensation in the back of my head again, that she wants me to try vestibular therapy. I'm happy and nervous at the same time because the last time I did therapy, I threw up every time I was there. I couldn't follow my finger. I couldn't walk in a straight line. I still can't. So I'll definitely take you on the journey with me for that, but that's where I am. So so I'm able to take a shower, could even kind of blow dry my hair a little bit, walking around, certainly not dealing with the snow or anything like that, but I've been cooking for myself. I can fold laundry. I can't carry the basket upstairs. I can actually load the dishwasher. I could do dishes. I can pick up, 1 or 2 things here or there, but yeah, I have to say I'm doing pretty well. My big question for him tomorrow is going to be, how do I deal with my weight restrictions going further? Like, when can I pick up 10 pounds, 20 pounds, 30 pounds, 40 pounds? When can I bend over and for how long? So if I'm going to take care of my dog, right? I want to wash my dog in the bathtub. I can't do that right now. What does that look like? I just don't know some everyday things like what can I do? It's not the gardening time of year, but you know, if I want to go out and do weeding, okay, that's bending over. I can't do that. So when am I allowed to do that? When am I allowed to pull stuff? When am I allowed to lift stuff? Even like birdseed, dog food, you know, any of that stuff. You know, even a 12 pack of Premier Protein, whatever. Like, I can't lift those things. So that's my question, really, that I have for him. The other question is, when does he think I'm going to start having sensation? He did tell me usually around 3 months, the nerves start to wake up and you start to feel pins and needles. And then usually around 6 or 7 months, they're like back. So we'll see. Right now, it just feels, it feels very numb to touch. There is pain still, and I think that's just from the surgical stuff. But it is a weird, like, Novocaine numb sensation. And then there's other times where my scalp, like, literally feels like it's burnt. But so far, so good. I'm very happy, and I'm really looking forward to seeing Dr. Nasser tomorrow. So thanks for checking in.